Stoke Animal Hospital, and today we're going to demonstrate administration of subcutaneous fluids to a patient. I'm going to explain to you today how to give subcutaneous fluids to an animal. Fluids that are basically the same things you would give intravenously through a catheter, but in animals, because of their large subcutaneous space, we can give those underneath the skin and hydrate them adequately that way. So we'll start off with the equipment that you're going to use. Very simple. We're going to have our bag of fluids. We're going to have an administration set that hooks onto our bag of fluids, and then a needle, and there are various size needles you can use that will hook on to the end of our administration set. So we'll start off with our bag of fluids. They're usually going to come in an outer wrap that's very easy to open. And most bag of fluids are going to be 1 liter bags, so each one of the markings on the side here, each one of the numbers, is going to be 100 mLs or 100 cc's of fluids. So here's my fluids up here at the top, which this would be 100 cc's, 200, 300, all the way down the bag. And how much fluid you're going to give depends on what your doctor recommends. The bag will have a plug in the end, and there's various styles of this, but all the bags will have some kind of a little plug that covers up the outlet, and you just give that a pull. There's still a seal inside the bag to keep it closed, so fluid will not leak out of the bag yet. And then we're going to open our administration set, and there's various styles of this tubing, which is basically just going to have a spike on one end that's going to drive into the bag, and a connector on the other end that will connect to our needle that's going to go under the skin. All the fluid lines will have a clamp like this one that will turn them on and off, and if you turn the thumb screw on the clamp all the way down, it's a pinch roller, and that's going to pinch that tubing tight. So right now it's pinched closed. If I roll this clamp upwards so the clamp can slide free on the tubing's now fully open. So we want to start off with our roller pinched closed. The other end of the administration set has a little chamber on it. We're going to take the guard off of the spike, and we're going to drive the spike into the IV fluids. You'd like not to touch the spike or the opening here because they're sterile. So I'm just going to push it in with a lot of twisting motion, and it's fully seated inside the bag. Now I'm going to lift my IV fluids up, and the little drip chamber here is right now empty, and my whole line is full of air. I'd like to purge all the air from my IV tubing line by giving this a little squeeze, and I'm going to fill that about halfway up with fluid, and then I'm going to open my clamp up, and I'm going to let the fluid fill my line up. And I'm going to let it go until all the air is purged out of it and my fluids are now dripping out of the other end. And then I'm going to turn my clamp off again. So now I've got my entire administration set now filled with fluid. If there's air bubbles in the administration set, don't worry about it. Since this fluid is not going intravenously into an IV catheter, it's okay if air bubbles run underneath the skin. I could run lots and lots of fluids into the animal with air bubbles in there, and it wouldn't hurt the animal at all. The other end of the line is where we're going to hook our needle on, and all the lines will have some form of a cap on the end, and you just remove the cap, and this is where your needle's going to attach. There's various size needles. Most commonly you're going to use an 18 gauge or a 16 gauge needle. Your doctor will prescribe whatever he feels is the right size. The needles all have a cap on the end of them that you can just twist very hard and twist the outer cap off, and then the hub of the needle will fit onto the end of the administration set, usually by just kind of giving it a little bit of a twist. And again, it will twist off, twist on. Then to uncap the needle, pull the cap of the needle straight off. When you want to replace your needle, put your cap straight back on again. We'll use a new needle every single time we give the subcutaneous fluids. Now we're going to get an animal and demonstrate actually administering the fluids to the animal. Now we've gone through the mechanics of setting up your fluids for administration. Now we're going to demonstrate actually giving them to the patient. So we've got a full bag of fluids here. I'm going to remove the cap from my needle, and the needle has a bevel on it. When you insert the needle into the animal, you'd like for the bevel to be facing upwards. And the most common place to give the fluids, the easiest place where the animal usually will object the less, is anywhere from about the base of the skull to about halfway down the back. So over the shoulder area here is where it's easiest to administer your fluids. And if you pick the skin up between your fingers and try and insert the needle under the skin right next to my fingers, I'm pinching my two edges of skin together. My needle's going to go in one side and right out the other. So when I lift this skin up, I make a little tent at the bottom of this skin, and I'm going to insert my needle at about a 45-degree angle. And when I actually do the insertion, instead of pushing the needle all the way under the skin, what I'd like to do is insert the needle just till the bevel of the needle is under, and then grab the fur or the skin and pull the skin backwards onto the needle. If you do that, you're less likely to push the needle all the way through the other side. So I'll pick up the skin, make a little dent here at the bottom, and just as I'm pushing my needle in, I'm actually pushing my skin backwards onto the needle itself. So my needle is now fully inserted. I can let go of the needle, and it will stay in unless the patient gets really rowdy on top of the table. Now we're ready to open up our fluids and let the fluids run underneath the skin. So I'll open my clamp fully. And now you can see the fluid dripping out of the bag through the drip chamber underneath the kitty's skin. If it's just going drip, 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 you're going to be here for a long time administering the fluids. You'd like this running in as a solid column of fluid. And you can either rotate your needle a little bit under the skin. Sometimes the bevel is against the body wall or against the skin. Or easier is just to put a little pressure on the bag. And now you can see that there's a solid column of fluid running through that drip chamber. So I'm just going to squeeze the bag until my fluid level in the bag gets down to the amount of fluids I'd like to administer. In this case, we're going to give about 200 cc's to our kitty. And as long as the kitty's not objecting, you can squeeze your bag quite hard. And you'll notice here we've run maybe 50 cc's of fluids in. We're not even down to the 100 line yet. And as the fluids get lower in the bag, sometimes it helps to actually roll the top of the bag down so that you can get adequate pressure squeezing the fluids underneath the skin. And you can see our kitty isn't really objecting at all to it. It's not painful. And every once in a while then I'll let go, hold on to the bag, and see we're already down to 150. So we'll squeeze a little more. And there we are down to the 200 line. So now we'll just close our IV fluid clamp to turn off our fluids. We've stopped dripping. When I remove the needle, I like to actually grab the skin where the needle is entering the patient and pull the needle out so I have the hole pinched between my thumb and forefinger. And I'll just keep that pinched just for a few seconds, and that'll help a little less fluid to run back out of the animal. You'll notice there's a lump of fluid now where we just administered the fluid under the skin. Gravity will pull that dependently, so in a little while you'll have a kitty that'll be puffy underneath the chest, maybe puffy under the elbows. Don't let that alarm you. That's just your fluids that gravity is pulling downward until the body sucks it up like a sponge. So, if you pull your needle out and you get a little bit of bleeding, that's very common because you just inserted a needle into the skin. And as a little bit of fluid runs out, it can be blood tinged. That'll stop very quickly, and as I say, you can see that this isn't painful at all for our patient. After finishing our administration, we'll recap the needle. Be careful not to poke yourself when you do that. And you can either leave this needle on until the next administration, or you can remove it again by twisting the needle to get it off and recapping it with the original cap that came on your administration set. While you're using your needle and your administration set, remember, try not to let these to touch your table or the animal. We want to try and keep the end of this sterile. Same thing when your needle is uncapped. Before you get ready to insert it in your patient, make sure not to let that touch anything because we want to keep that needle sterile. After you're finished with the needle, since we're using this one time, you want to save these in a little container, bring them into your veterinarian for disposal. You don't want to throw those sharps into your trash. You have a patient that's not as wonderful as Apollo is here and might object a little bit to the fluids. One of the biggest reasons why cats in particular will object is because people are trying to restrain them very tight onto the table. And the cat isn't objecting to the subcutaneous fluid administration. What they're objecting to is the restraint. So it's best to use minimum amount of restraint. The cat can actually walk around in a little circle on the table. One person can keep him corralled, but don't try and restrain him really tight because that's what he'll object to. Some kitties will object no matter what, and you might want to take a towel and just kind of wrap the kitty up with the towel. You can even wrap the front end a little bit up so he can't see. Wrap the rear end up. Leave yourself just a little bit of room open where you can go ahead and administer the subcutaneous fluids. If it's dark inside there, the kitty's less likely to get anxious.